Welcome to this explainer. Today, we're diving straight into a fascinating and honestly, absolutely crucial journey inside the human urinary system. We often brush off urinary issues as just a minor annoyance, right? A brief discomfort that'll eventually pass. But the reality is that what starts as a highly localized issue can rapidly become a life-threatening escalation. By looking directly at the clinical data today, we're going to decode exactly how and why this happens.
Here is the roadmap for our explainer today. We'll start by decoding the terminology, then examine the anatomy of an infection, break down uncomplicated versus complicated cases, uncover a pretty sneaky silent threat, and finally, look at severe symptoms and complications. Let's get right into it.
Section 1. Decoding the terminology and building our medical literacy. Let's kick this off by establishing a really clear baseline. In medicine, words literally matter, and there are a couple of terms here that get mixed up all the time. Let's distinguish between pyuria and bacteriuria. Pyuria specifically refers to the presence of leukocytes, which are your white blood cells, in the urine. Bacteriuria, on the other hand, simply means there's a detectable amount of bacteria hanging out in the urine. Do you see the distinction there? One is your body's active immune cells showing up for a fight, and the other is just the presence of bacteria itself. Clinically speaking, they mean very different things.
So this brings us to the crucial point of understanding what actually constitutes a true UTI, or urinary tract infection. A real UTI requires significant bacteriuria in a patient who is actually experiencing physical symptoms or signs pointing right at their urinary tract. And importantly, there can be absolutely no alternate source to blame for those symptoms. Just having bacteria isn't enough to call it a true infection. You need that significant bacterial presence combined with active physical symptoms.
Let's move along to Section 2, Anatomy of an Infection. It's time to investigate the scene of the crime.
Think of the urinary tract like a highly specialized, heavy-duty plumbing system. The whole process starts high up in the kidneys, where urine is actually formed. From there, it gets actively moved downward toward the bladder through two long tubes called the ureters. Finally, when the bladder reaches a critical volume, we feel the urge to void, and the urine exits out through the urethra. But here's the thing, this system isn't just passive plumbing. It is built for defense.
Our bodies have these brilliant mechanical and chemical fortress defenses built right in. First off, the ureters use peristalsis, a physical, rhythmic pumping action to force fluid down. The entrance of the ureters into the bladder is angled, forming a functional one-way valve that totally prevents urine from flowing backward. Plus, the urethra normally just remains collapsed to literally block the door. Chemically, the environment is incredibly harsh for any microscopic invaders. We're talking high ammonia concentrations, hyperosmolarity, low pH, and even antibacterial secretions from the prostate. All of these features work together to make the urine highly resistant to bacterial colonization.
Moving to Section 3, Uncomplicated versus Complicated UTIs. Here is where we explore the escalating conflict when those fortress defenses actually fail. Imagine an uncomplicated infection as a single, straightforward person walking down the street. It follows a predictable path. It's your everyday, standard infection. But contrast that with a huge, chaotic, dense crowd. That represents a complicated UTI. It's multifaceted, it's messy, and it involves a lot more challenging variables. This brings us to a vital clinical question. Why is it so incredibly important for medical professionals to know if a UTI is complicated? What actually changes when an infection shifts from a single, predictable path to that chaotic crowd?
Well, the stakes get significantly higher. When a UTI becomes complicated, there's a much higher risk of life-threatening urosepsis. The bacteria involved in that crowd are far less predictable, and multi-drug resistance is super common. Because of all this chaos, a standard guess just won't work. A formal urinalysis and urine culture are heavily indicated to figure out exactly what the doctor is fighting, and ultimately it demands a much longer, way more aggressive course of treatment.
That takes us to Section 4, the silent threat. We're going to pivot to a paradoxical scenario where danger lurks without any obvious warning signs. Remember how we defined a true UTI earlier as absolutely requiring physical symptoms? Well, there's another condition called asymptomatic bacteriuria, or ASB. This is defined as having a significant number of bacteria in the urine, but in a patient who is completely asymptomatic. They feel absolutely nothing. No burning sensations, no urgency, zero physical signs at all.
But a lack of symptoms doesn't mean a lack of danger. For most healthy adults, ASMB might not be a crisis, but for highly vulnerable populations, like pregnant women, this silent threat poses severe risks. If significant bacteria are just sitting there in the urinary tract unnoticed and untreated during pregnancy, it can lead to massive complications for both the mother and the development of the child. Because of this, medical professionals closely monitor specific vulnerable groups for these asymptomatic infections. Alongside pregnant women, this includes children, the elderly, and individuals living with diabetes mellitus. All of these groups have immune systems or anatomical conditions that make an unchecked, silent bacterial presence incredibly dangerous.
And there is one more highly vulnerable group on that list: patients undergoing urinary tract instrumentation, like the use of a Foley catheter. When foreign instrumentation is introduced, it totally bypasses the body's mechanical defenses, like that collapsed urethra we talked about earlier. A catheter-associated infection, or a CAUTI, can happen in a patient whose tract has been catheterized within just the previous 48 hours. It's a rapid, silent breach of the body's fortress.
Which brings us to Section 5, Symptoms and Severe Complications. We have finally reached the climax of our anatomical journey.
What happens when these infections go dangerously untreated, or when those lower defenses are completely bypassed? We face a severe escalation known as pyelonephritis. This is the clinical term for when the infection has traveled all the way up those ureters and has launched a direct attack on the kidneys themselves.
So, how do we distinguish a standard bladder infection from a full-blown kidney emergency? Pyelonephritis carries the standard symptoms of a UTI, but it aggressively turns the dial up to 10. We see high fevers over 38 degrees Celsius, chills, intense flank pain, extreme tenderness in the costovertebral angle, which is your mid to lower back, and severe nausea or vomiting. If a patient presents with these, the infection has escalated into a major medical event.
The ultimate, high-stakes consequences of allowing these infections to spread are quite literally fatal. The infection can spill into the bloodstream, causing septicemia. It can cause permanent renal parenchymal damage, completely shutting down the kidneys and leading to renal failure. It can trigger severe hypertension. It can even cause hematuria, which is blood in the urine, and in some wild, complicated cascades, it may even be a sign of endocarditis, an infection of the heart's inner lining, or point to an autoimmune disease.
We've seen how beautifully designed the body's defenses really are, and how absolutely catastrophic it can be when those defenses fail, leading to everything from silent bacterial growth to complete renal failure. This leaves us with a final provocative question to reflect on. Are you treating your body's most vital filtration system with the respect it truly deserves? Thank you so much for exploring this fascinating medical landscape with me in today's Explainer. Until next time, stay curious and keep learning.